All right, welcome back to our Achilles Tendinopathy series. This is phase 2 recovery video. So this phase is for if you've got 5 out of 10 pain or less when you do repeated calf raises. So that's the little test that you do to see where you're at. So if you've got 6 or more out of 10, you need to go back to our phase 1 and work through that. Phase 2, our goals are to start strengthening the tendon and stimulating that tendon healing and repair. So the tendon responds to specific exercises, and we need those exercises to actually repair the degeneration. Rest alone won't do it. So in the clinic, we're starting to use a combination. Before we were just using distal acupuncture. We're still going to use that, but we're going to start incorporating a little bit more local acupuncture, and that's where we use points around the affected area, and there are things that we can do to further reduce pain, but also help promote the tendon healing a little bit more specifically. We also may recommend herbs if we think that that's appropriate to support the recovery process as well. So outside of the clinic, you're going to start incorporating what's called eccentric strengthening exercises. Now, before we get into the exercises, really important throughout this whole recovery process, you need to use pain as your guide. So if you do these exercises and during or even within 24 hours afterwards, you have a flare-up of the pain in the Achilles, then you need to stop or do less, regress, rest up, that kind of thing. Muscle soreness is okay, so you might feel like normal muscle fatigue soreness from being exercised and worked, let's say in the calf muscle, but you should not be getting like sharp pain or like flare up of your Achilles tendinopathy pain after these exercises. So if you do anything or you do some an activity or whatever that flares that up, just be mindful to regress and look after that, because you don't want to push out your recovery time any more than is needed. Okay, so the gold standard exercise for mid-tendon tendinopathies, so this is where the affected part of the tendon is somewhere 2 to 4 centimeters from the attachment. The gold standard is called the Alfredson protocol. But you can modify that Alfredson protocol to better suit insertional tendinopathy. So that's where the insertional part of the tendon, where it attaches into the heel, is affected. So you just need to modify that, and I'll demonstrate both of those variations for you in a sec. But essentially, once you get to a point where you're not really experiencing much pain, you've done this Alfredson protocol for 6 to 8 weeks, then you're okay to start moving into phase 3, which is just an addition of extra exercises to start rebuilding some more elasticity in the tendon. Anyway, I'll cut to the Alfredson protocol and run you through that now. All right, phase 2 recovery exercise. So this is based on the Alfredson protocol, which is the gold standard for mid-tendon tendinopathies. But I'm going to also show you a variation of this after I run you through it, of how to adjust it for an insertional Achilles tendinopathy. So the exercise, pretty straightforward. It's a calf drop exercise. So you need a step to do this. So I've got a step here. You can do it on your stairs. Just make sure you've got somewhere like against a wall to balance on if you need it. So how you do this exercise, I'm going to pretend my left Achilles is the injured one. So what you're going to do is straight legs first of all, come up on your toes with both feet, and then down on the affected side. So up on both feet, and then down on the affected side. Up on both feet and then down. So that's eccentrically loading this left calf. So it's loading as it's descending. So that's the first variation. So you're going to do that exercise, 15 reps of this, and then you're going to bend the knees and do the same thing. So this gets a slightly different muscle in the calves, the soleus. So going up on the toes and then again bending down. Up on the toes and then down on one foot. So you're going to do 15 reps of that, and you can build up to 3 sets. So the Alfredson protocol is 15 reps of each of those, 3 sets, twice a day, every day for 3 months or 12 weeks. So it's pretty intense, and I've tried to do the exercises, and if you just go straight into it, you're going to have very sore calves. So my recommendation is to actually build up to those numbers. So first time I would suggest doing just one set of each of those exercises twice a day. So 15 reps of straight leg, 15 reps of bent leg in the morning, then do that in the afternoon. If you're fine over the first few days, or you're finding that's too easy, add in another set, and then you can add in a 3rd set if need be. And if any of this, again, use pain as your guide, if any of this aggravates pain, you need to reduce the amount or give yourself rest. You will get muscle soreness with this, so muscle soreness is fine, but you shouldn't be getting pain in your injured Achilles. So the variation that you can do for an insertional tendinopathy is same thing, but without a step. So you're just going to do it on the ground. So again, up with both feet and then down with one. So what this does is when you're going down on a step, that's really loading up the insertion. So you want to avoid that with insertional tendinopathy. So if you're finding that the exercise is really aggravating your pain, you might have an insertional tendinopathy or a portion that's down near the insertion, and you might be better off trying same protocol, but just flat on the ground. All right, give that a go and let us know if it helps.